Hey ma'am, I am Dorabel Kelapinik from Novo Doctors College. Ayan na lang. So good day ma'am, I am Dorabel Kelapinik from BSN 212E Group 19, and today I will be performing the subcutaneous injection. But first, we have to check the doctor's order to ensure that we are getting the right medication, dose, route, and for the right patient. Next is I will be checking the medication administration record or MAR to verify the accuracy of the prescribed medication to prevent medication errors. Next is I will be checking the medication carefully against the EMIR to make sure that the correct medication is being prepared. It also confirms that the right medication is selected, reducing the risk of errors. Now, following the 3 checks for administering medication, we're gonna read the label on the medication when it is taken from the medication cart. Next is before withdrawing and after withdrawing the medication. So this enhances the patient's safety by verifying medication accuracy at multiple points. So after that, I will be organizing the equipments. So to ensure that we have a smooth and efficient procedure by having all necessary supplies readily available. Next is to perform hand hygiene and observe other appropriate infection prevention procedure to deter the spread of microorganisms. Next is to provide privacy for the client by closing the doors or the curtains to maintain the patient's dignity and comfort during the procedure. Next is to prepare the client. I will be ensuring the client that he is well informed and ready for the injection. So prior to performing, I will introduce myself first and verify the client's identity using the agency protocol. So hello sir, I am Dorabel Kelapinik from Novo Doctors College, and I will be your student nurse for today. May I please see your wristband, sir, and kindly state your name and your birthday?
Joshua Alexis Sumugod, September 5, 2004.
Alright, so Sir Josh, today I will be injecting you or assisting you in injecting the insulin shot. An insulin shot is usually done or injected at your skin or just below your skin at the fatty side, not at the muscle, but rest assured that it is not painful. So insulin shots are commonly used for insulin, other vaccines, and also for blood thinners. So later on, sir, I will be exposing your abdomen. Is that okay with you?
Okay.
So after that is I will be assisting the client's position in which the arm, leg, or abdomen can be relaxed. So depending on the site to be used. So it facilitates an easy access to the injection site and minimize discomfort. So if we have a client that is very hard to handle, we can obtain assistance in holding the client by asking help from the other nurses. Next is to explain the purpose of the medication and how it will help using the language that the client can help. So, sir, I am here to help you with your insulin shot, as what I have said earlier, so that you can have, it is also used to reduce like your insulin levels, sir, that some insulin, this will help you control your blood sugar levels. Okay, sir. Next is to select and clean the site. So to prevent the infection and also to ensure the proper medication absorption. So the site that I have chosen is on the abdomen side. So the site that I have chosen is free of tenderness, hardness, swelling, scarring, itching, or burning. Also, it is a site that has not been used frequently because we have reduces discomfort and to promote effective medication absorption. Next is I will be applying gloves to maintain the aseptic technique and prevent contamination. After that is we will now be, so as agency protocol indicates, we have to clean the site with an antiseptic solution. So we're gonna start at the center and go in a circular motion about 2 centimeters and also we're gonna allow the area to dry thoroughly. After that is we're gonna place and hold the swab between the third and the fourth fingers with our non-dominant hand to or position the swab on the client's skin above the intended site. It is to keep the reason for this is we have to keep the swab accessible for immediate post-injection pressure application. So now we're gonna prepare the syringe for injection to ensure that the syringe is set up for accurate administration. So we're gonna remove the needle cap while waiting for the antiseptic to dry. We're gonna pull the cap straight off to avoid contaminating the needle with the edge of the cap. It is also to maintain sterility of the needle and prevents contamination. Now, I will now be injecting the medication to ensure a proper administration of the prescribed dose. So, I will grasp the syringe in my dominant hand by holding it between my thumb and the finger, with palm facing to the side or downward with an angle of 90-degree angle insertion. And after that is I'm gonna prepare now to inject. Next is to my dominant hand. I will pinch or spread the skin at the site and insert the needle using the dominant hand in the firm, steady push. It is to ensure that the proper needle insertion and reduces the discomfort of the patient. Now, I will now be injecting by pulling the skin of the patient. So I'm gonna insert now the needle. And now after that is I will now be after injecting, we're gonna remove the needle just the way as we pull it, as we enter it. And after that is I'm gonna after that I will put the cup of the needle. So by pulling it with the same line as we insert, we're reducing trauma to the injection site and prevents medication leakage. So if bleeding occurs, we have to apply pressure to the site with dry sterile gauze until it stops to prevent hematoma formation and promotes clotting. Next is we will now go to the disposing of our supplies appropriately. So after that, I will be assisting the client to a comfortable position. Thank you so much for your cooperation, sir. After that is, I will now be doing the aftercare. I will remove my gloves, dispose using the items and appropriate waste receptacle. Next is to return other equipment. Hand hygiene assist the effectiveness of the medication at the time it is expected to act. Next is to document all the findings that we did to ensure that the accurate records for continuity of care and legal purposes. That will be all. Thank you.